Hi, I'm Congressman Harley Rouda, and it is a pleasure to be with you today as the OC Women's Health Summit begins. And thanks to you, Allison, and the OC Women's Health Project for your absolutely incredible leadership and for hosting such an important event for our community, even during these extraordinarily difficult times. Women have been fighting on the front lines of this pandemic and are facing unique challenges both at home and in the workplace. 1/3 of essential jobs are held by women. A majority of the social and healthcare workers are women. Women truly are keeping our nation running during the coronavirus crisis. When asked to discuss women's issues, my colleague, Senator Harris, likes to joke and say, "So glad you want to talk about the economy." She's right, especially during the pandemic. Economic policy, worker protections, and paid leave are women's issues. In Congress, I've helped pass 4 bipartisan bills to provide critical economic assistance and bolster our public health response to the ongoing pandemic, including funding for testing and PPE. Most recently, House Democrats passed the HEROES Act, which would provide additional urgent relief to protect the lives and livelihoods of the American people. In addition to my votes in DC, since the start of this crisis, I've been talking to a variety of stakeholders like hospital workers, small business owners, and teachers. I've also hosted panel discussions with experts to increase awareness of the challenges being faced by Orange County families and Americans across the country. One issue that has been exacerbated by the coronavirus crisis is domestic violence. I co-sponsored legislation, including the Bipartisan Domestic Violence Public Health Emergency Guidance Act, which would encourage federal engagement with domestic violence stakeholders and relevant law enforcement to issue guidance and outline best practices and resources to state and local enforcement agencies, with a unique focus on addressing domestic violence effectively while limiting potential exposure to COVID-19. In fact, in the Bipartisan CARES Act, we allocated $45 million for the Family Violence Prevention Services Act and another $2 million for the National Domestic Violence Hotline. Sounds like a lot of money, but the truth is these funds are not enough. Domestic violence and child abuse programs have been historically underfunded, and I'm deeply concerned how insufficient these funds are to meet the challenges that many are currently facing and that many, many more will face in the coming months. We also know there's an increased demand for mental health services, and I've urged House leadership to advance measures that would ensure equal coverages for all health services, including mental health services. Our healthcare workers, a majority, again, of whom are women, are facing trauma head on. They need mental health coverage and assistance to process and treat that trauma. And we must continue to ensure access to health care more broadly. Quality, affordable health care should not be out of reach for anyone in Orange County. And let's be clear, this includes sexual and reproductive health care as well, including access to birth control, abortions, and gender-affirming care. I know I don't have to tell all of you, but I'll say it anyways, birth control is health care. We have seen repeated attacks from this administration, even during a global health crisis, to defund community health centers and Planned Parenthood. It's reprehensible to do that at this time, and I will keep fighting to ensure more Americans have access to health care, not less. There's still so much more that the federal government must do to support all Americans during this difficult time. We know so many of these issues, like access to health care, equal pay for equal work, and targeted resources for communities most in need, are interconnected in advancing women's health. Frankly, COVID-19 has helped shine a light on long-standing disparities. I want to thank all of you for your work to keep our community safe and healthy. Your work is truly invaluable to families and women across Orange County, and I'll keep standing with you and fighting in Washington and Orange County to address women's issues like paid leave, workplace protections, small business support, and health care. Thank you, and stay safe.